COVID, the impact of COVID on businesses and testing. And as you've been saying, there's an urgent need for safe, fast, reliable testing. So particularly so that the hardest hit sectors can get back on their feet, travel, for example, sporting events, hospitality, and so on, and care, of course. I know you have repeatedly voiced concerns about the performance of testing. And of course, now we're moving toward vaccines, and there are criticisms there, aren't there, about currently about how effective the launch of the vaccine distribution has been. But I just wondered what your thoughts were on testing.
So on testing specifically, yes, I mean, as the Liberal Democrats Health and Social Care spokesperson, as well as in my capacity as Twickenham MP, it's something I've been very, very active on and vocal on. I've had many opportunities to challenge Matt Hancock directly in the House of Commons on testing issues. And we are at that point now where a lot of the testing for symptomatic individuals is working much better, whereas you look back at September time, when the schools went back and suddenly the demand went through the roof, which was completely to be expected when children and young people were all going back into schools, and people couldn't get tests. And I challenged Matt Hancock that I was hearing from people that they were being told to book tests in Aberdeen and they could get a test in Twickenham with the Aberdeen postcode, which was just absurd, that they were essentially being told to game the system to be able to access a test, people not being able to get them back promptly. That was a real problem. So I think that is working better. Now we're getting a lot of this community testing being rolled out, and here in Richmond there are 3 wards on the Twickenham side actually that have been given lateral flow tests. There are obviously questions being asked about the accuracy of them, but at least there is some provision there for people who may be asymptomatic to be tested. So I have concerns perhaps on the accuracy of those in terms of how widespread they're being used. My concern now has been much more about the tracing and the isolation part. So for all parts of the economy, whether it's one of the hardest hit areas or one of those that's less hard hit, all parts of the economy to open up and function well again, we need a really strong test, trace and isolate system. We've seen that around the world, the countries that have done that best and have also had stringent public health measures around their borders as well, again with testing and quarantining on arrival, have fared the best. And you look at examples like South Korea and Taiwan, and although Germany is now experiencing a surge in infections, actually, relatively speaking, their infection rates, their death rates have been much lower than ours. So as a European comparator, they've been pretty strong on this. And I think one of the areas where the government's gone badly wrong, and that I have constantly challenged, and so have other opposition MPs, it's not just me and it's not just the Liberal Democrats, that locally led contact tracing has been by far and away the most effective way forward. And this constant reliance on the national call centre, which has been contracted out to Serco. I have no ideological issue with the private sector being involved where that's appropriate, but it needs to be in the hands of experts. And what Serco have proved time and again is they're not doing it very effectively. Their tracing rates, they're improving now, but most of the time it's been down in the sort of 60% contact tracing rate, whereas the local authorities who've been doing it are close to between 90 and 100%. Now, you only break the chains of transmission if you not just test, but also trace and then isolate every contact. Tracing's been poor, the isolation rates have been down through the floor, and there needs to be not just more financial support, but much more practical support to make sure people isolate. And if we get test, trace and isolate right, then the economy can start to get back on its feet while the vaccine's being rolled out.
Well, I will feed this back as well to the London Chamber of Commerce. As you know, I'm the deputy leader now of the local London chambers.